So why would I care about my kidney function as a diabetic?
And then anything above 6.5% is actually diabetes. And so blood sugar is actually going to fluctuate throughout the day. Hello, everybody. Today I'm joined with Adam, who will be role-playing a diabetic patient. And we're going to be going through his blood work to see if he's got any questions that I can help him with. So we're ready to get started?
Yeah. So really my first question is about the eGFR value. What does that tell us and why is it important?
Exactly. Great question here. So the eGFR value actually stands for something known as your estimated glomerular filtration rate. And I know this sounds very complicated, but simply put, it's really just a measure of how well your kidneys can filter blood to urine.
Okay, I see. So why would I care about my kidney function as a diabetic?
Right. What happens is over time, diabetes can damage the blood vessels in your kidneys, and then that can lead to something known as diabetic kidney disease, which can really hamper your eGFR values and your kidney function. So it's important for us to know things like your kidney function because it can dictate things like which medications you use to treat your diabetes, but it can also be a good indication of how your diabetes is affecting your kidneys in the first place.
Okay, that's interesting. I never really thought about it that way. So what would be a normal eGFR value that I should be looking for in my blood results?
Good question. A normal eGFR value would be above 90, and then below 60 would indicate something like mild to moderate kidney disease, and then generally below 15 would mean that dialysis is required.
Okay. And what about the HBA1c value? It says here that I have a value of 7.4. Is that normal? And what does it really mean?
Right. So an HBA1c or a hemoglobin A1c test is something that measures the amount of blood sugar or glucose attached to a specific protein in our body called hemoglobin. And what the HbA1c test really shows is, on average, over the past 2-3 months, what's the average amount of glucose that's been attached to this hemoglobin, which is a protein in our red blood cells.
Interesting. And I'm guessing it's a 2 to 3 months average because from what I know, that's typically how long a red blood cell lives.
Exactly, right again. And so as for what's normal, we would say anything below 6.0% or 6% is normal. Anything between 6 to 6.4% is prediabetes. And then anything above 6.5% is actually diabetes. And so your value of 7.4 would actually fall under that diabetes range.
So if HbA1c is a measure of my blood sugar, what's the glucose fasting?
That's a great question. So another lab result you'll see is something called glucose fasting. And glucose fasting will require you to basically abstain from eating overnight or for 8 hours before you take your blood test at the lab. And this will kind of just measure directly the glucose levels in your blood. So it won't measure what percent of your hemoglobin has that glucose attached to it, but instead it'll just measure the amount of glucose levels in your blood. And as for what's normal, below 5.6 would be normal, 5.6 to 6.9 would be prediabetes, and then 7.0 and above would be diabetes.
Okay, so that makes sense. So HbA1c is a 2 to 3 months average blood sugar. Glucose fasting is my blood sugar fasting overnight. So then what's the finger pricking test I do at home? Is that the same thing?
Good question. So it can be, but it's usually not. And so what I mean by this is, the test you do after you wake up, after you haven't eaten in a while, that would kind of simulate your glucose fasting test. And then if you were to do it anytime during the day, that would kind of simulate a glucose random test, which you can do, after you've had a meal or in the evening or right before you go to bed even. And so this is a good way of figuring out how your blood pressure, your blood sugar is actually going to fluctuate throughout the day.
Okay, so just to confirm, the value I measure at home and the HbA1c value I get from the lab are different.
Yeah, and I'm so glad you picked up on that because that's actually one of the biggest misconceptions we have here at the clinic. The finger pricking blood sugar values you get at home are different from the HbA1c values that you get from the lab. So a 6.0% or a 6% HbA1c value does not really equal a 6.0 blood sugar value. In fact, a 6% HbA1c value is the equivalent of your blood sugar values being around 7.0 at home. A 7% HbA1c value would be 8.6 at home, 8% would be a 10.1 at home, and then a 9% on your HbA1c would indicate that 2 to 3 month average being around 11.7, and so on and so forth. Here's a little chart that you can take a look at just to see how those things compare.